Welcome to Chapter 2 of our Dry Eye series, all about intense pulse light therapy. Before we dive into what it is and how it works, let's review what dry eye is and some of its root causes. Dry eye is a complicated condition in which we produce insufficient or poor quality tears, and as a result, it causes burning, stinging, itching, or gritty eyes. Although it affects up to 50% of the world population, everyone has individual contributing factors and therefore respond differently to treatments. With that being said, a vast majority of cases, over 80%, are due to meibomian gland dysfunction. It may look something like this, where the oil glands of your eyelid stop producing quality oils, leading to evaporation of your tear film and increase in tear osmolarity, causing ocular surface damage, which triggers inflammation. This results in a vicious inflammatory cycle that just continues, causing and worsening your dry eye. So how do we break this cycle? Over-the-counter eye drops that we often see actually only relieve your symptoms, but won't fix the root issue. The solution is IPL. It stands for Intense Pulse Light, and it's a relatively new advanced in-clinic treatment option for dry eye. It's essentially a handheld device that shoots pulses of high-energy light into the tissues near your eyes. Although its use in dry eye treatment is relatively novel, the technology has been around for decades and is commonly used in dermatology to treat acne, rosacea, or spider veins and such. So how does high-energy light manage dry eye? In short, it's believed to work through four main mechanisms. First, photocoagulation. In dry eye disease, abnormal blood vessels grow in the eyelids, delivering inflammatory molecules which invade the glands and damages them. IPL burns or kills off these blood vessels, stopping inflammation and allowing our oil glands to heal and produce better quality oil. Consequently, the oils prevent our tears from evaporating, effectively breaking the cycle. Second, the high-energy light generates a lot of heat, which penetrates into the oil glands to melt any blockages, allowing improved flow of oil into the eye surface, again breaking the cycle. Third, the light energy kills off microorganisms in the eyelid margins, removing bacterial buildup and eyelash mites. The presence of these organisms cause inflammation, which impacts oil gland function. Shown above is a video taken through a microscope of a Demodex mite that is killed by IPL. Feel free to check out this video for yourself. Lastly, IPL also helps to relieve dry eye associated pain by reducing molecules that cause inflammatory and neurogenic pain. The treatment is typically administered over 4 sessions, spaced 2 to 4 weeks apart, with a maintenance session once a year after that. Before IPL treatment, you first need a thorough dry eye assessment to accurately diagnose dry eye disease and specifically meibomian gland dysfunction. To learn more about what a dry eye assessment consists of, check out our video before. It's important to show up to your IPL appointment without any makeup, sunscreen, or contact lenses. During your treatment, our technician will perform a deep cleaning and exfoliation of your eyelid margins and eyelashes using a technology called Zest. Next, an eye shield with anesthetic eye drops or an eye sticker will be applied to your eyes to protect it from the strong light pulses. You can then sit back and relax. The rest will be taken care of by our technicians. A cooling gel will then be applied along your cheekbones and eye areas. After choosing the correct settings, they'll use the handheld device to apply pulses of light to your cheeks and eye areas, and you'll see a bright flash when the light pulse is delivered and also feel some warmth. This might cause mild discomfort but should be tolerable and will not be painful. Working around your eyes, the procedure should take approximately 30 minutes per session. When it is done, your technician will remove the gel and you're ready to go about your day. Although this procedure is very safe, there are some risks you should be aware of, as with any medical procedures. You may notice temporary redness and/or swelling immediately after the treatment, but it should go away within a few hours. And remember earlier when we talked about using IPL in dermatology? Well, with IPL dry eye treatment, you get all of those same benefits, including reduced spider veins, rosacea, sunspots and freckles, red-brown pigmentation, which evens out your skin tone, it brightens your complexion, and restores healthy, youthful-looking skin. Feel free to reach out to us if you have any questions.